This is the video on how CT scans work. CT, or computed tomography, is a type of bioimaging that utilizes many narrow X-ray beams to generate cross-sectional slices of the body. Many of the slices are then stacked on top of one another to generate a 3D image. The first CT scan occurred in 1971 on a patient in London with a frontal lobe brain tumor. After about 80 years of research, since the first X-rays were used in the 1890s, Godfrey Hounsfield and other researchers at EMI Central Research Laboratories developed this new type of bioimaging that combined X-ray imaging with computing. The result was incredibly successful as the surgeons claimed the tumor itself looked just like the scan. The CT scan was able to show a textbook image of the tumor and its position in the brain. This was not seen before in any imaging study. CT scans rely on computers reconstructing images based on multiple overlapping X-rays. This is achieved through a rotational X-ray source. CT machines have a motorized X-ray tube that rotates around the patient. These shoot X-rays through the body at many different angles until a full revolution has occurred. That one revolution produces a slice, typically between 1 and 10 millimeters thick. The bed then moves through the CT machine, so the next slice can be taken by the rotating X-ray tube, and this continues until all the slices have been taken. These can be presented slice by slice, or they can be stacked together to render a 3D model. These 3D models can then be colorized and made to rotate in all directions, giving the physician a full view of the brain and the abnormal area. CT scans revolutionized the bioimaging game because they were the first scans to differentiate the soft tissue inside the skull. These brain CTs now diagnose everything from tumors and other lesions to brain bleeds, blood clots, and strokes. Soft tissue identification was further idealized when contrast agents were introduced. An intravenous contrast agent can be injected into patients. These agents have been engineered to target certain types of tissue, are harmless to the body, and show up easily on CT scans. The contrast seen in the image can help doctors diagnose different abnormalities and their borders within healthy tissues. CT scans, just like X-rays, have their risks as they use ionizing radiation. The rewards of diagnosing potentially life-threatening issues, however, greatly outweighs any potential issues with radiation, as precautions are always taken and limits are carefully observed. These risks are also addressed in the radiation video. CT scans have revolutionized the bioimaging world and saved countless lives. The overlapping X-ray technique, using trajectories at different angles, combined with new technological advancements in computation, made this all possible. This ends the video on how CT works.